Hello, my name is Dr. MarkAlain Dery, and I am the Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. You've seen me do these updates now for the past few months in conjunction with the leadership of the ACOI. I hope these messages are helping you keep up with the latest on COVID-19. I know many of you are in the thick of the fight, and I would like to thank each of you on behalf of all of us who daily focus on infectious diseases for a living, and certainly on behalf of the ACOI. I live in New Orleans, Louisiana, and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. And as we are facing this once-in-a-lifetime global battle, I want to hear from you, my colleagues, who are experiencing the fight from their locations, no matter where you are in the country. I provide my contact information at the end of each of these updates, so please listen for that. I hope you take me up on this invitation to reach out. Moving forward together with the ACOI, we will continue to share information as it becomes available, as well as some of the hopeful progress that we are seeing. Also, for more information on the ACOI's new peer-to-peer well-being check-in sessions, which are awesome, and they're available free of charge to ACOI members, please go to acoi.org/COVID-19. Click on the box so you can find out how to join in. These Zoom sessions are an awesome way to feel connected to your peers and also feel some support during this challenging time. So, COVID is out of control in Arizona, and this signals a shift in pandemic responsibility. The country's situation the country's attention has turned toward Arizona. As the new hotspot, with COVID-19 cases tripling from 2 weeks ago, experts are now looking at the state as an example of what not to do. Within the last week, cases in the state are averaging more than 1,300 per day, and COVID-19 positive test results have grown from 5% to 12% in just 2 weeks. Arizona's stay-at-home order expired in mid-May, and at this time the state's governor had no plans to renew the order or to require any mask wearing in public at all. Now, while some states have opened with phasing approach, as we did here in Louisiana, Arizona's approach was very aggressive with respect to reopening, and now public health experts nationwide are pointing to this approach and the early reopening of the state as the reason why the spike is so dramatic. Phased reopening, as many of the states are doing, are smart because they give public health agencies time to identify whether or not cases are rising, and then it allows time to respond with contact tracing and isolating those who are infected. Epidemiologists at the University of Arizona are saying Arizona's approach should be a warning sign to other parts of the country. And with the current spike, contact tracing in the state may not be able to keep pace. Even more frightening are that public health systems can't keep up without state governments acting as a partner to help slow the spread. The full burden of the pandemic is now being placed squarely on those of us that are in healthcare. At least that seems to be the message that's coming from Arizona's actions. Living in New Orleans, I see our geography and our levees as the perfect metaphor for this type of response. So hear me out. Our levees were mostly built for Category 3 storms and could not handle the Category 5 storm surges that hit and, of course, sent deadly floods into New Orleans in 2005 during Hurricane Katrina. Now, COVID-19 is like a Category 5 storm, and the danger of shifting the responsibility from the government to putting the full weight on the healthcare system is endangering healthcare workers, as well as, of course, putting a strain on the healthcare system. The healthcare system relies on the competence of the government to protect the public with policies that slow the virus and hence ease the burden on the hospitals. But without those actions, the hospitals are like those levees that are only prepared for a Category 3 storm when in fact a Category 5 storm is fast approaching. And to make matters worse, Arizona has not yet stopped elective surgeries, which was the plan if hospitalizations exceeded 80%, which they have. So hopefully by the time this video is posted, the state will have halted their elective surgeries, which, by the way, not only consume hospital beds, but also use up valuable and scarce PPE. Now, last week I talked about my own personal belief and an op-ed that I wrote regarding empirical evidence that when masking goes up, COVID goes down, right? Hashtag mask up, COVID down. Mask up, COVID down. On behalf of healthcare workers, I'm hopeful that the governor of Arizona will consider making masks a requirement. The state is on a precipice of a growing health disaster, and when governments partner with those of us in healthcare who are the soldiers waging the battle, we can help more people. Remember, folks, we are all in this together. So the next really interesting story is that slowing the coronavirus spread is speeding the spread of other diseases. And so let's talk about that. So how is the COVID-19 pandemic raising the risk of other crippling diseases that are spreading that were once controlled by vaccinations? Well, when the attention shifts to most urgent pandemic issues in the room, that's how. In other words, in poor countries around the world, there was a temporary suspension of their vaccination programs. Of course, right? There was COVID-19. Now, with the danger of children gathering for shots combined with the halt of vaccine supplies as the pandemic diverted these efforts, some vaccine programs were slowed and actually halted. Now, perfectly preventable diseases from cholera to polio are unfortunately making a resurgence. A mutated strain of the poliovirus has been reported in more than 30 countries, and measles is flaring around the globe, including in Bangladesh, Brazil, Cambodia, the Central African Republic, Iraq, and other countries. In fact, of the 29 countries that have currently suspended measles campaign because of the pandemic, 18 are now reporting outbreaks. The risk is that nearly 200 million people are at risk of missing their measles shots this year. This pandemic is potentially creating a future epidemic, and the president of Doctors Without Borders, Médecins Sans Frontières, is saying that measles could potentially kill more children than the current coronavirus pandemic. Let me repeat that. The president of MSF, or Médecins Sans Frontières, Doctors Without Borders, is saying that measles could potentially kill more children than the current coronavirus pandemic. As the current pandemic continues, the World Health Organization is now urging countries to resume vaccinations, although vaccine supplies are still hard to come by. The president of the organization is warning that the disruption to the immunization programs from the COVID-19 pandemic may unwind the decades of progress that have been made against diseases like measles. And the frightening thing is that for many of these countries, the worst of the COVID-19 pandemic hasn't even hit, which of course will further weaken their capabilities to handle outbreaks of other diseases. This has implications in the US since rates of immunizations in wealthier countries like the US has also been decreasing during the pandemic, and some states are reporting a 70% drop of vaccinations. And I think the quote from an advisor from the Global Immunization Division at the CDC said it best when he said that these vaccine preventable diseases are just one plane ride away. It's incumbent upon all of us to recognize it's so important to reach out to our pediatric colleagues, to our family practice, our family physician colleagues, and really help with respect to making sure that the message is out there that we really need to find these children who may have missed their vaccines and get them into the clinics so that they can get vaccinated. There's lots of really creative ways of doing this. At the clinic system that I work at in Louisiana, we're doing drive-through vaccines. I'm seeing that that's happening in other states as well. Folks are just basically lining up in their cars and the clinic staff are just coming out and able to inoculate children right there in the car. So, in conclusion, stay on the lookout for these regular topics, and to read more from the sources that are used in this report, go to ACOI.org. /COVID-19, and together with the ACOI, we will help you have the latest information to help you respond to your patients and stay on top of this crisis. Of course, as always, please feel free to reach out to me anytime at madery@mac.com. Please stay safe. We can do this together. Let me center. There we go.